Hi, my name is Ebony Funches, and I'm a family nurse practitioner and Doctor of Nursing practice student at Brandman University. When I embarked on my doctoral journey, I was asked to create something called a PICO question, which is a burning clinical question, and it all stems from something that you want to change in practice or an area of pretty much passion that you think that is lacking in healthcare as far as the data goes. Immediately when I started this process, I thought of prediabetes. Not only do I have a personal attachment towards it, but I saw in my past 8 years of working in healthcare, I see a lot of people being diagnosed with prediabetes initially, and then as the years progress, their A1C, which we'll talk about further, continues to go up and up till it becomes diagnostic for diabetes. Um, Diabetes, as we all know, is completely preventable. And if you catch it when you're pre diabetic and continue to work on lifestyle changes such as exercise and diet, you reduce your chance of getting diabetes significantly and or slowing down the process, which in the end can buy you years as far as longevity and preventing complications from your blood sugar being too high. So, as far as the personal attachment, many of you may not know, but I was severely overweight at some point, and at some point, my doctor did tell me that I was pre-diabetic. And like you, when I heard the word diabetic, I don't care about the prefix. I was terrified. I didn't know what this mean. I thought that it meant that I was diabetic or going to be very soon. And I had family history, a significant family history of diabetes and obesity, and I immediately changed my lifestyle. I reduced the amount of calories. I started exercising every day and limiting the amount of carbohydrates that I was eating in my diet. And over the past months, I continued to lose weight. And when I got my A1C rechecked, which is a measurement of your blood sugar over 90 days, I was no longer in the pre-diabetic range. So I knew that with me doing it on my own and seeing the significant change in reducing my chance of diabetes, I wanted to help others, especially in the clinic where I work at, where the majority of my patients are pre-diabetic and are diabetic. Um, and so that's a little bit of background information on this project and why we're all here. I not only want to help you guys live a healthier you and reduce your chance of getting diabetes, but I want to just educate the community on this preventable disease and um, ways to just change your life for the better. According to the American Diabetes Association, prediabetes is blood sugars that are not necessarily at the level of diabetes, but they're higher than normal. Um, Many people with prediabetes don't even know they have it, meaning that there is no symptoms for it. Diabetes, which if you're pre-diabetic, it should be done every 1 to 2 years. As far as the A1C goes, it measures your blood sugar over a time span of 2 months to 3 months, usually 3 months. And pre-diabetes is diagnosed when the A1C is between 5.7% and 6.4%. Once you get to an A1C of 6.5, it's diagnostic for diabetes. But usually doctors don't diagnose you with diabetes unless you have classic symptoms or if the A1C is astronomically high, such as 14 or 9, 10. But at 6.5, usually the test is repeated, and if it continues to rise or it's diagnostic for diabetes and you have symptoms, then at that point, treatment will be sought. There are other tests, of course, to check for diabetes, but the standard is usually the A1C. I really want to put some of your fears to rest with the education that I'm going to provide throughout this whole program that you're about to endure. Prediabetes, just because you have prediabetes doesn't mean that you're going to develop diabetes automatically. Like I said, this is something that we can actually prevent. Research does show that if you reduce your body weight, meaning lose 7%, which isn't a lot, 7% of your body weight, that you can reduce and or prevent the onset of diabetes. Exercising moderately, which we'll talk about in detail in one of our sessions, will just help reduce your chances even more. How did I get it? That's actually a common question, and despite some of the beliefs regarding eating a lot of sugar, there's actually well studied and well documented risk factors, is what we call them, to developing prediabetes. One of them being the age. So if you are 45 years old or older, you're higher to become diagnosed with prediabetes. If you're of African American descent, Hispanic, Pacific Islander, and also if you are Asian American. If you have a parent or a brother or sister, which is also known as a family history with diabetes, you're more likely to be pre-diabetic as well. As I discussed a little earlier, being obese, which was one of my personal risk factors, um, inactivity, just not exercising, being one of those person who just goes to work, goes to school, make excuses to not exercise, increases your risk of this diagnosis as well. If you have high blood pressure and or if you're on medications for high blood pressure, it increases your risk and is a documented risk factor. Having a low HDL, which is high density lipoprotein. It's a component of your cholesterol, and it's also known as the quote unquote good cholesterol in your body. And that goes up by increasing your physical activity as well. If your triglycerides are high, which are associated with saturated fats and diets high in fast foods and poor dietary choices, you're also more increased risk for having prediabetes. A diagnosis of PCOS, which is also called polycystic ovarian syndrome, you're also at increased risk because, as you know, a lot of those patients are on metformin because it helps with ovulation and also to reduce their blood sugars. Also, if you had diabetes in pregnancy, which is also known as gestational diabetes, those patients are at higher risk of developing diabetes and or prediabetes. Okay, let's talk symptoms. So, as discussed, prediabetes really doesn't have any overt symptoms. When you have symptoms such as increased thirst, um, and frequent urination, things like that, you've moved on from, most likely, you've moved on from pre-diabetes to actually having diabetes. But if you have pre-diabetes, sometimes you may have darkening of the skin in certain areas, such as the back of your neck, um, underneath both armpits, in the groin. Us medical professionals call that acanthosis nigricans, and it may be a clue that you may have insulin resistant or increased blood sugars. And a lot of times doctors will see that and will immediately order the A1C to determine if you have diabetes or not and are pre-diabetes. But as far as symptoms goes, there really are no clear symptoms as far as the current research goes. And if nothing is done and you remain with prediabetes and your A1C continues to go up, you will develop these complications. So as far as complication goes, they're never pretty. It includes blindness. It affects your large vessels and your small vessels. So you may get poor circulation. Therefore, if you get a wound or you step on a nail, you know, things are likely to heal at a very slow rate, and sometimes that develops in something we call gangrene. And in order to stop that infectious process, that limb or that toe has to be cut off, and you lose disability and function of that extremity. So, another complication is it affects your renal vascular system, meaning your kidneys. And over time, the large protein molecules that normally don't pass through a healthy, good kidney passes through. And that is one sign, what we call proteinuria or microalbumin. Protein is passing through your urine, and that's a warning sign that your kidneys are slightly damaged already from the high blood sugars. Basically, your blood is full of sugar. Just think it being saturated and full of sugar that it becomes viscous or so thick that it does not pass through the kidneys, and meaning your kidneys don't get enough oxygen and blood supply and nutrients because of the slow, thick sugar in your blood that parts of it dies over time, and then years and years of that continued process is going to result in end stage renal disease where your body cannot, you don't urinate or you urinate very little, and waste and toxic products just continues to build in your system, and you have to go to dialysis 3 times a week or do it at home through a peritoneal, which is a device in your stomach. But either way it goes, you have to reduce the amount of toxic waste and the buildup of potassium, which can affect all of your organs and or reach levels that affects your heart and makes you acidotic, like full of acid, that you ultimately go into cardiac arrest or have EKG changes or have arrhythmias, which is irregularities of your heart, and ultimately it can lead to cardiac arrest and death. So, unfortunately, the complications are not pretty. So, those of you, which are all of you, who have a chance to reduce your risks and stop the onset of diabetes, I completely urge you all to do it, because once you get to the point of diabetes, it's often difficult to control your blood sugars, and you have to be even more stricter with your diet than you are when you're pre-diabetic. And it's just it's not a fun disease process, unfortunately. Um, Reducing your weight. So if you're 200 pounds, if you lost 15 pounds, that'll be about 7% of your weight. That will significantly reduce your risk to about 50%. Also, if you cut back on calories, that goes hand in hand with dieting and exercise, reducing the amount of saturated fats that you're eating, and also increasing your daily activity. All you really have to do is 30 minutes of physical activity 5 days a week, which is equal to 150 minutes a week of exercise. And it doesn't mean you have to go get a gym pass and spend money. You can go out with your family, walk your dogs for 30 minutes, do chores, sweep around the house. Things that you enjoy. Don't make it something that where it's not enjoyable, because then most likely you won't want to do it. So with that being said, the treatment is pretty easy. Some people who A1Cs are on the higher end. Some doctors, well, research has actually demonstrated that actually starting you on metformin early on at a low dose can actually help reduce your risk of getting diabetes and or halt it down. So I wanted to thank you for being a participant in my study and your willingness to come and learn more about how to prevent diabetes and to get educated and hopefully reduce your personal risks to developing diabetes. I know that getting a diagnosis of anything is not easy. Trust me, I've been there, but I appreciate your time. In the next couple of weeks, we will be having more sessions. Um, in session number 2, we will specifically be discussing nutrition and ways to reduce your weight. We'll be reading labels and learning exactly how to live a healthy lifestyle through diet. And it will be followed by sessions that include experts in nutrition, a dietitian, and also it will also, and the final session will teach you um, different activities to do around the house or even local places such as the park, which includes the 30 minutes a day, 5 days a week schedule to reduce your risk of diabetes. With that, I hope you enjoyed the education that I provided during this session. And so, if I can get about 5 more minutes of your attention, I wanted to leave you with a great video from the CDC, which is the Center for Disease Prevention and Control. They'll show you how they did a similar project for patients who were pre-diabetes and were able to reduce their risk as well, so that you not only believe what I'm saying, but you believe it coming from a nice, credible source, that this is actually something that you can do.
All right, back again, week 13 of our diabetes prevention program, physical activity, yay!
The classes that are part of the National Diabetes Prevention Program work because they have been studied and tested. We have known for some time now, based on really well done research studies, that you can prevent or postpone type 2 diabetes. This is the opportunity for us to implement those findings in a way that the population can experience it.
Tim, looking at how far you've come, what else what else is out there? Where else do you want to go? In their core 16 weeks of this program, participant will come in and meet once a week with their facilitator and their small group. We'll sit down and we'll discuss one of our 16 lifestyle topics for that day.
I've been pre-diabetic for over 2.5 years, and I've just kind of ignored it because that word pre was there.
I knew that my blood sugar was high. I would watch my diet a little bit and then I would stop, but I didn't do anything consistently on a consistent basis.
There's an issue with the patients not realizing the problem is as bad as it is or as bad as it may become.
Chicken burgers, and they all had them.
The first few weeks of the program, we're talking all about fat gram intake, behavior modification, your level of activity and how physically active that you are during the day, and stress management.
Stress management is a very important piece when it comes to lifestyle change. It affects people's eating, it affects people's physical activity, it affects everything that has to do with lifestyle change.
A lot of people think you have to have machines and tracks and things like that to constitute exercise. But what we look at in the class is how active are you really throughout the day?
I like to walk early in the morning. It gets your day started, and it's a good little power walk, and it's free. It doesn't cost anything to walk here.
5, 6, 7. Initially, I was in denial about the fact that there's a higher percentage of African Americans affected by diabetes than other ethnic groups. But all around me, friends, family, church members, I was seeing younger and younger people affected by the disease. One of the things that we were required to do was to set a goal of weight loss, set a nutritional goal, because we established what our fat gram content had to be for the day. We were to set in our books exactly how many minutes we were going to exercise every day.
The real success is that people are working together to try to find the solutions and to support each other.
Without the class, I would have never done this on my own because I had tried. I had done every single thing out there that I could think of.
My hope for this program is that many physicians across our community will use this resource as their first line of defense against type 2 diabetes. That's what our program is here for.
This is really the example of what we wish would happen in many fronts, is that the government, the private sector, and the community sector would really join forces and come together to solve these problems.
My patients love the idea of being able to have a program to be healthier going forward. My patients really love that. They're surprised that they can actually get older and be on fewer medications.
I am so excited because I went to the doctor last week. All of my numbers were down, and I am officially no longer pre-diabetic.
There are almost 80 million people that have prediabetes. My dream is that in the next few years, it will be easy for people to get access to this program. And ultimately, we will be able to say fewer people are developing type 2 diabetes.